name's Maria Loads. I'm a senior lecturer and a clinical psychologist on the doctorate in clinical psychology at the University of Bath. So we found a couple of interesting things. The first is about disease containment as a context specifically. So there's very little known about how disease containment measures like social distancing and quarantine impact on mental health in children and young people. We found just one study that's looked at that previously. And what that study found was that children and young people who had been subject to disease containment measures of social isolation or quarantine were significantly more likely to need mental health service input subsequently. And the study particularly looked at trauma outcomes and found that those children who had experienced disease containment were more likely to have post-traumatic stress symptoms and to meet a diagnosis of post-traumatic stress disorder. Beyond that, though, when we looked at the literature about loneliness and social isolation more broadly, what we found is that there's quite a lot of evidence that social isolation, but particularly loneliness, impacts on mental health. That's both at the time when they're measured together, but also when they're measured over time. So if a young person is lonely now, we know that that will increase the likelihood of them developing depression and probably anxiety. What else is important that is indicated by the literature, although there are not many studies looking at this, is it's the duration of loneliness, so how long the loneliness goes on for, rather than the intensity or the strength of the loneliness, that really seems to make the difference in predicting depression, particularly over time.